Sige, let's have our review. We have anti-cancer drugs. And then we have learned yesterday na the anti-cancer drugs are divided into two. They are either cell cycle specific or non-cell cycle specific. So nag-start tayo with the cell cycle specific with our anti-metabolites. Do not forget how we call them anti-metabolites. Their structure is derived from the normal compounds that we see in our body, especially those compounds involved in the DNA and RNA synthesis. Now, since their structure is derived from this compound, they can be a competitive antagonist to the receptors of these compounds in the body. So that is why we call them anti-metabolites. And the first group of drugs under these anti-metabolites, which are actually cell cycle specific, especially in the S phase synthesis of the DNA and the RNA, is we have the antifolate agents, or we simply call this antifolic acid agents. Yesterday, we ended with methotrexate. This is a favorite board exam question, because aside from being an anti-cancer drug, methotrexate can also be used as a drug for autoimmune diseases like Crohn's disease, the arthritis, rheumatoid arthritis, and even psoriasis. So that is because of its action na nag-i-inhibit siya of converting the folic acid to its active form. We call it tetrahydrofolic acid. So itong vitamins na ito, vitamin B9, is really important in the cell division. So if you give this to a person with cancer, syempre ma-inhibit ang pag-divide, pag-multiply of the cancer cells. Now in the autoimmune diseases naman, since the problem is overly active immune cells, then if we inhibit the proliferation or we will inhibit the multiplication of this type of cells in the body, then that will suppress the action. It will suppress the immune system, thus helping on the autoimmune diseases na mga conditions. That's the action of methotrexate. Just don't forget the enzyme, the target enzyme of methotrexate is the dihydrofolate reductase. Again, we call it dihydrofolate reductase. And what is the work of this enzyme? It works in the conversion of folic acid to the active form called tetrahydrofolic acid. So, i-inhibit niya yan. Para ma-summarize lang yung medyo complicated na mechanism of action ni methotrexate. Kato inyong tandaan. Then another thing na inyong tandaan about methotrexate is that the patient should be given enough hydration for this, or water, because methotrexate is not really soluble to water. Thus, it will deposit to the kidneys. It will become crystals, and the patient may experience crystalluria, wherein his or her urine has the presence of the crystals, and that is very painful during urination. So daghanon na to ang tubig para ma-dilute. So yan yung ginagawa for our methotrexate. Okay, questions so far? And another thing, another board exam favorite question about methotrexate is the antidote. So for example, the patient may experience toxicities brought about by the methotrexate. What we give is the leucovorin, or we sometimes call this folinic acid. So its structure is actually similar to the folic acid para ma-antagonize si methotrexate. Pag may mga antagonistic action, especially if competitive binding to the enzyme, we can reverse that by giving another group of drug, patas una to ang iyahang concentration. So mapildi na si methotrexate. Sorry, wait lang ha. Wait lang. Okay, we have pemetrexed. This is the next drug after methotrexate. Asa sila under? This is still under the antifolate agents still under the anti-metabolites. Now, for the mechanism of action, the same thing with methotrexate, but it can also inhibit another enzyme kasi si methotrexate is on the dihydrofolate reductase. Si pemetrexed, aside from the dihydrofolate reductase, it can also inhibit another enzyme, the thymidylate synthase, and other enzymes pa dyan involved in the metabolism of the folic acid and at the same time, the DNA synthesis. Later, I will talk about what is the work of the thymidylate synthase. Iisa ko na lang siya with another drug. Pero just remember, kasama siya dito kay pemetrexed. Now, when do we use the pemetrexed? Ginagamit siya for non-small cell lung cancer. So again, this is for lung cancer, especially for non-small cell na lung cancer. Now, what are the adverse effects of this drug? Meron siyang hematologic and gastrointestinal toxicities. So, para maiwasan ang problem with the blood and also the gastrointestinal tract, pemetrexed is given with folic acid and vitamin B12 supplements. So I hope you don't find it ironic na the action is to inhibit the conversion of folic acid to its active form, but the drug is given with folic acid. So the reason why we give concomitantly the folic acid is that to avoid lang the hematologic and especially the gastrointestinal tract na mga toxicities. But aside from the folic acid, that's vitamin B9, we also include vitamin B12 supplements. That's the cyanocobalamin. And the patient, before giving the pemetrexed, should be pre-treated with the corticosteroids to avoid or to prevent cutaneous reactions. Because this drug is like a strong drug, it can affect also the skin and layers of the skin class, kaya magkakaroon ng mga inflammation and so on. Kaya binibigyan ng corticosteroids. And then we have the last drug here under the antifolate drugs, the pralatrexate. Murag pare-parehas man sila og name, no? With the methotrexate. So yung mechanism of action is the same thing with the methotrexate. Inhibition pa rin ni dihydrofolate reductase, which inhibits the conversion of folic acid to its active form. But what kind of cancer does pralatrexate? Wait lang, your internet connection is stable. Can you hear me? Or nagaputol-putol ko?
Nawala ako dali, ma'am.
Yes, ma'am.
Kalit man gud siya sulhat og your internet connection is unstable. But anyway, pralatrexate class is used in those T-cell lymphoma wherein ano na siya, nag-relapse or merong refractory na T-cell lymphoma. And then adverse effects, mucositis. So this should be given with folic acid and vitamin B12 also. So that is also true with the pemetrexed a while ago. Due to this, what is mucositis? Any idea what mucositis is? Let's wait. Sige, ito stomatitis gahapon. Makalala pa what stomatitis is. Looking for ako nilang chat. yung stomatitis, yes, Claire. Ang stomatitis, inflammation sa mouth. How about the mucositis? Parehas pa rin. Ang mucositis is still inflammation sa mouth. Mucositis is still inflammation sa mouth. Especially, mucositis is mostly seen as adverse drug reactions ng mga cancer chemotherapy agents na to. Sobra pa sa luas manggod ginagmay lang, no? Pero ang sa ilaha man good, mostly sa ilahang apil ilahang gums and kaning mga buccal cavity, there will be inflammations, there will be sores. So that is due to lack of folic acid also. So that is the reason why, though it inhibits the conversion of folic acid to its active form, we also give concomitantly the folic acid just to avoid those things, mga mucositis, mga inflammation in the mouth. Nganong pag-cancer? Pag-cancer, class severe gud na siya, whether terminal na siya nga stage or dili pa. Painful gud na siya, pero it depends on the individual. Ang uban manggod kung bago pa siya nga stage, wala gid na sila bation. Pero pag terminal na stage na, since advanced stage na ang cancer, nagkalat na siya. So daghan na kaayo ang cells sa sulod, mao na siya nga painful na siya kaayo. And especially solid tumors, kay mudako man gyud na siya, no? So pag mudako siya, that will stretch all the pain signals kung asa man siya located. And dili siya basta-basta matreat with just the paracetamol, of course. Kay grabe na gyud ang stretching aside from the tumor itself. Tanan pain receptors na adinha. So mao na ang sakit jud na siya kaayo. So kung terminal na ang cancer, most likely we don't wala nang treatment talaga, but palliation na lang siya, palliative care, wherein we give mga mga pain reliever, pero mga narcotic ones na mga morphine para lang jud na bisag terminal stage na dili gyud ka ng grabe-grabing pag-suffer. Ang problem nato, daghan og mga cancer patients na mamatay sila not because of their cancer though, but because of the narcotic analgesics. Labi na ang morphine, kasi pag grabe ilahang pain, no, tapos tagaan og morphine, and then syempre drug na alang siya certain duration of action. When the effect of the drug subsides, syempre magsakit na pud na. And ang tendency na mangayo na pud og morphine ang patient, or in some cases ma-addict na gani sila kay sige-sige na ilahang lawas maka-receive og morphine. Kaya lang morphine manggod is notorious of causing respiratory depression. So maglisod na hinuon sila ginhawa, and then again daghan og cancer patients na mo na ilahang cause of death. Sobraan sila sa morphine. Okay? Questions so far? Before we'll move on to number 2. This is anti-metabolites. Basig malibog mo class, your internet connection is unstable na po ko. Basig malibog mo ha. We are talking about cell cycle specific drugs. We are on the anti-metabolites, and these are the examples of anti-metabolites. Number 1, anti-folate agent. So we have 3 drugs there. And then after the anti-folate agents, this one, the fludarabine, is another drug under anti-metabolites. Pero hindi na siya under sa anti-folate ha, para lang di ta maglibog. Okay. Sige. So we have again number 2 anti-metabolite, the fludarabine, which is the 5-phosphate of 2-fluoroadenine arabinoside, a purine nucleotide analog. So yesterday, let me draw sa screen ha. Okay, di ko kabalo mag-drawing, pero sige na lang. Di ba pag double helix ang ato ang DNA, and then nagdraw ko na kagahapon kanang strand na ni for example, this is an alternating sugar, phosphate, sugar, phosphate, sugar, phosphate. And then the other strand, nakita ninyo itong sa video kagay na 3 to 5 and 5 to 3 direction. Hindi kasi sila magkapareho. If this strand starts with a sugar, the next strand will start with the phosphate. So naka-alternate yan siya. Now at the center are what we call the nitrogenous bases. Or we call them, if they come into threes, ay nakatatlo-tatlo sila, we call them codon. And nakapartner-partner yan sila for DNA class. Always yan siya. Adenine is partnered with thymine. And then cytosine is partnered with guanine. Okay? So mani siya ha ang ato ang pag-partner-partner sa ilaha. Diri na sila makita at the center. So example, you have an adenine, always yan siya ang partner niya ay thymine. So purga, kasi purine bases, dalawa tayo, guanine and adenine. So guanine and adenine. And then picat means cytosine, uracil, and thymine. So sa DNA, you cannot see uracil ha. I believe you know that you have this in your biochem. Okay, sana all may ka-partner. Okay, you have this in your biochem. Uracil is not found sa DNA. Makita lang nato na siya kay RNA. So sa DNA, kanilang ang magpartner. Guanine to cytosine, adenine to thymine. So purine bases to pyrimidine bases yan siya always. And they are connected by hydrogen bonds. So naapod na siya sa inyong biochem. Now, I told you anti-metabolites are analog of these compounds which are normally found in our body. So the next na atong i-discuss, let's just separate anti-folate agents because their action is on the folic acid. The rest of the anti-metabolites are actually analogs of these compounds. Some of them are analogs of adenine, others are of thymine, cytosine, or guanine. So again, their structures are related to these nitrogenous bases. So for fludarabine, from the name itself, you will have a hint there na it is an analog of our adenine. So to be specific, it is actually a 5-phosphate ng 2-fluoroadenine. So you have the adenine here connected with a fluorine. Okay, so kana inyong tandaan, fludarabine is analog of adenine. But where do we use this drug? Chronic lymphocytic leukemia, hairy cell leukemia, and non-indolent non-Hodgkin lymphoma. So this is more of the immune cells, like the leukemia, if you have a lot of white blood cells, and also with the lymphoma, then doon natin ginagamit si fludarabine. Wait lang, let me delete the writings on the screen. Okay, but let's talk about the mechanism of action. This one is a prodrug. Again, the fludarabine is a prodrug. And then inside the body, the phosphate, di ba 5-phosphate group siya of the 2-fluoroadenine. So inside the body, ma-metabolize siya. The phosphate group will be removed. And the 2-fluoroadenine arabinoside is being formed. So para di ta maglibog, ako ang ibutang sa screen. Hindi siya kung ginaingon, medyo lisod learn of anti-cancer drugs. So this one is a prodrug here. Meron yan siyang phosphate in its structure. Ma-metabolize siya. And then phosphate will be removed. And then ang kanyang resulting metabolite is called the 2F-ARA-A. So this is 2-fluoroarabinoside adenine. And then since ito yung active, this will be taken by the cell and further magkakaroon ng further metabolism inside. So ma-phosphorylate na naman siya, madadagdagan siya. Kinuha natin ng phosphate, di ba? Pero inside the cell, it will be phosphorylated. So dadagdagan na naman siya ng phosphate. And the enzyme responsible for that is the deoxycytidine kinase. Now, pag nagkaroon na siya ng phosphate, nag-add na tayo dito ng phosphate. This is inside the cell ha, ito outside. Ito inside the cell. Itong 2F-arabinoside adenine phosphate will be incorporated to the RNA or the DNA. And that will cause termination of the DNA and the RNA synthesis. Kasi hindi naman talaga siya adenine. Again, hindi naman talaga siya adenine na nitrogenous base na commonly makikita sa structure. Galing siya from the outside source, though the structure is related, pero it's not really the adenine. Once na ma-incorporate yan siya doon sa DNA or sa RNA, that will decrease now the synthesis. Ma-terminate ang ating DNA and RNA synthesis. And for cancer cells, that is actually good kasi the synthesis of the DNA and the RNA sa cancer cells will be stopped, and the cancer cells will also stop proliferating and mamatay yung cancer cells. Pero again, do not forget na wala tayong cancer-specific drug. So if fludarabine can inhibit the RNA and DNA synthesis of the cancer cells, it has also the ability to inhibit the RNA and DNA synthesis of the healthy cells. It's our problem with our anti-cancer drugs. Now, how do we administer the fludarabine? It should be administered intravenously. We don't give it orally because our normal flora or normal microbiota, the bacteria which can be normally found in our intestine, can metabolize this drug. Again, the microbiota or the normal bacteria in the intestine can metabolize the drug. It can split the drug, iyahang kwaon ang sugar, tapos mabilin ang fluoroadenine na part, mawala tong arabinoside. Arabinoside is actually a sugar. So ang mabilin is the fluoroadenine, and that is very toxic. So again, that is the reason why we don't give the drug orally. Okay? Wait. So that is for fludarabine. Any question? Kailangan yun ninyo mag-study aniha kay dili lalim si anti-cancer drugs. Dili pod sila common. Kasi hindi naman talaga natin always nakikita si anti-cancer drugs. We don't deal that much with cancer patients. And we don't even open the anti-cancer drugs in the pharmacy. Because remember, we can be exposed. And there are, especially the alkylating agents, pwede sila mag-induce ng tumor din. Now, number 3 for our anti-metabolites is the cladribine, which is also a purine analog. And just like the fludarabine, this is also an analog of the adenine. So specifically, chemically, we call this 2-chlorodeoxyadenosine. So the mechanism of action is still the same with that of the fludarabine. Since this one is an analog of adenine class, ang structure niya pareho. So pwede siya, instead of adenine yung mapunta doon sa DNA and RNA synthesis, kung magkakopy na, so dadagdagan ng adenine, ito pwede siyang ma-incorporate doon. So again, pwede siyang ma-incorporate especially in the 3' terminal end of the DNA. So ma-stop ang DNA synthesis. It will inhibit the elongation of the DNA. Wala na yung makopy, ma-stop na siya. And at the same time, it can also affect DNA repair. Kasi remember sa DNA, pwedeng mag-repair. Dati ginatawag of mutation, right? Pero actually, the DNA polymerase enzyme, the one that is responsible for the synthesis talaga or for the replication, that enzyme is capable of repairing, proofreading, and repairing kung, for example, meron mga mali nga na mga nakopy during the replication. Pero if magkaroon ka ng cladribine in the DNA sequence, it can also inhibit the repair. So it can also inhibit the ribonucleotide reductase, another enzyme that is responsible naman doon sa RNA synthesis. That is cladribine. Now, what kind of cancer cells yung binibigyan ng cladribine? We have hairy cell leukemia, the chronic lymphocytic leukemia, and non-Hodgkin lymphoma. So pareha sila ni fludarabine na most likely ginagamit for immune system na mga cancers. Next, number 4, 5-fluorouracil. From the name itself, you will really see na kung asa siya asa siya derived ang structure. So, syempre, uracil, picat, a pyrimidine analog. Now, unlike the fludarabine and cladribine, 5-FU, we call this 5-FU, is primarily used for solid tumors, especially those na slowly growing solid tumors like colorectal, breast, ovarian, pancreatic, or gastric carcinomas. Or we can also use this for topically or superficial na mga basal cell carcinomas sa mga skin or sa mga linings of the organ. Now, let's talk about the mechanism of action of the 5-FU. 5-FU is 5-fluorouracil ha. So if we give this to the patient, syempre it will be taken up by the cell, especially by the target cell. Now, inside, ganito yung nangyayari. Medyo makalisang siya tanawon, no? Pero let's try to discuss it slowly para maintindihan nyo. Si 5-fluorouracil, syempre, i-take up siya ng ating target cell, and there will be series of metabolism there for the 5-fluorouracil. It will be converted to 5-FUMP, 5-FUDP, and 5-FBUMP. So, mo nila mga meaning ha, pag 5-FU, 5-fluorouracil, 5-4-fluorouridine, 5-FUMP, that's 5-fluorouridine, monophosphate, and so on. Pero wala na ko na gina-require na memorize ninyo. This is just to let you see the step-by-step conversion of the 5-fluorouracil to 5-FBUMP. It's the meaning of 5-FBUMP, 5-fluorodeoxyuridine monophosphate. Now, this substance, this metabolite from the 5-fluorouracil can inhibit the conversion of DAMP to DTMP. DAMP is the oxyuridine monophosphate, and then DTMP is the oxythymidine monophosphate. Actually, ang gina-inhibit niya talaga is this enzyme, the thymidylate synthetase, which was also mentioned sa kay fludarabine. So, kana siya, the DUMP manggod, pag mahimo na siya DTMP or the deoxythymidine monophosphate, this one is needed for DNA synthesis and cell growth. So again, that chemical substance is required para magkaroon ng DNA synthesis and at the same time cell growth. So daghan kayo siya steps nga giagian, mauwi lang gina siya tanan in the inhibition of the DNA synthesis and multiplication of the cancer cells. Sana daw ni ilang yan. Say 5. 555 nga dilata lang imuhang matandaan kaning mga tanang 5 din wala sa mukha. Okay, to summarize, let's summarize the mechanism of action of the 5-fluorouracil. Again, itong series of metabolism of 5-FU in the body will lead to the formation of 5-DAMP, which is an inhibitor of this enzyme, thymidylate synthase. Anong trabaho ng enzyme na ito? It will convert DUMP to DTMP. Alin dyan yung kailangan for DNA synthesis? This one. This is needed for DNA synthesis and cell growth. Therefore, if we inhibit this using the 5-FU, wala tayong DTMP. It will just remain as DUMP. So wala tayong enzyme or wala tayong compound na magagamit for DNA synthesis. That's how it helps a person with cancer. Okay? So actually, karugtong din yung kanilang mechanism of action ni methotrexate. Kasi si DTMP, aside from the DTMP, itong enzyme na ito, thymidylate synthase, is also used in the formation of the dihydrofolate. And also, ito yung, wait ha, kaya hindi na ako makita, kaya na nagaharang. Okay, your internet connection is unstable na po daw. Wait lang dyan. Okay, ayan. Sige, wala na nakaharang. Mabasa na ako siya tanan. Okay. So the same enzyme is actually needed to make the dihydrofolate. This is the active form of your folic acid. Kaya lang si methotrexate manggod is more of the inhibition of this enzyme, the dihydrofolate reductase, para maging dihydrofolate siya. Pero si 5-fluorouracil, ganun pa rin. Aside from na-inhibit ang formation nitong DTMP, mai-inhibit din ang formation ni dihydrofolate and the tetrahydrofolate na donor. So wala pa ring activation of the folic acid. So magkarugtong ang kanilang mechanism of action, but they are separate drugs, but they are both anti-metabolites. Okay? That is for the 5-FU. So to summarize, the antifolate agents like methotrexate will inhibit the enzyme dihydrofolate reductase para hindi ma-convert si folic acid to its active form, while si 5-FU will inhibit the thymidylate synthetase enzyme para hindi ma-convert si DAMP into DTMP. DTMP is needed for cell growth and DNA synthesis. And at the same time, that enzyme na i-inhibit ni 5-fluorouracil can also activate the folic acid. So mafo-form pa rin si 5H4, the active form of the folic acid, kung merong thymidylate synthase. So pwede din natin siyang i-inhibit with the 5-fluorouracil. So kung wala na sila, DTMP o the active form of folic acid, there will be no DNA synthesis. So hindi makaproliferate yung cancer cells. Now what's the adverse effect of our 5-FU? There is severe toxicity to the gastrointestinal tract. So pwede siyang mag-cause ng mga ulceration, pwedeng ang patient magkaroon nausea, vomiting, and diarrhea, basta severe na toxicity on the gastrointestinal tract. Okay, questions so far about, that's the 4th drug under sa anti-metabolites. Wala pangutan na or wala pa nag-sink in? Wala. So we have here another drug, anti-metabolite pa rin, the capecitabine, which is orally given. It's a fluoropyrimidine carbamate. Pero this one is also a prodrug. Inside the body, it will be converted to 5-FU. So again, capecitabine will become 5-fluorouracil in the body. And so if it becomes 5-fluorouracil, it will follow the pathway also. Katong pathway kagaina sa 5-FU, na mahimo siya 5-FDAM, and mahitabo na ang pag-inhibit sa mga compounds needed for DNA synthesis, ma-inhibit to siya tanan. That's it for capecitabine. And then we have the cytarabine, which is cytosine arabinoside, or we call it ARA-C. ARA-C ha. So kung makita natin, cytosine, dito siya, pyrimidine analog siya, specifically the cytosine. May sugar lang siya na component, we call it arabinoside. So, pero ang generic drug, ang generic name niya talaga cytarabine, pero chemically we call it cytosine arabinoside or ARA-C. So, analog siya of the 2' deoxycytidine, in which the natural ribose residue is replaced by the arabinose. Kasi remember, yung DNA and RNA natin, supposedly ang sugar niyan is the ribose. Ribose for the RNA, and then for the DNA, it's deoxyribose. But in the case of this analog of cytidine, instead of the ribose, it is replaced by another sugar called arabinose. Yan lang yung pagkakaiba nila, pero the structure is the same. So what is the mechanism of action of our cytarabine? Since this one is an analog of cytidine. So, syempre, it will be an antagonist to the pyrimidine, especially the cytosine. So, what happened to the cytarabine inside the body? Just like the other drug na na-mention natin, it will be phosphorylated inside the cell para maging ano siya, cytotoxic siya sa cell mismo ang kanyang action. Ano yung magiging cytotoxic form niya? We call it cytosine arabinoside triphosphate. Naglagay lang tayo ng phosphate. And if it becomes the ARA-CTP, it will become an inhibitor of the DNA polymerase. So this is still a cell cycle specific na agent, especially on the S phase, wherein DNA synthesis happen. So, unsa iyahang gina-inhibit? Let me write sa screen para mas klaro. Cytarabine inside the body will be converted to ARA-CTP. ARA-CTP is cytosine arabinoside triphosphate. We will just add the phosphate part there. And ang trabaho nito is inhibition of the DNA polymerase. So if you watched the video a while ago and if you can still remember your lesson sa biochem, the DNA polymerase is the key enzyme that is responsible mismo for the DNA replication. So without the DNA polymerase, walang DNA replication na mangyayari. Kasi 'di ba, let me show you what happened again for the DNA synthesis para magkasinabot ta. So the DNA is a double helix, right? Pero before magkaroon ng replication, it needs to be unwind. So ang enzyme responsible dyan is the helicase. Kailangan niya talagang paghiwalay yung dalawang strand. That's the work of the helicase. Pag nahiwalay na yung dalawang strand, after that, the enzyme na mag-work is the primase. This is to make the primer for the DNA. Parang paunang strand na yun yung parang magiging signal ng start na ng replication. Now, after the primase, the one that will be at work now is the DNA polymerase. So si DNA polymerase na yung magkakopy ng mga codon doon and mangyayari na talaga yung DNA replication. So if you inhibit that using the cytarabine, then walang DNA na mangyayari, DNA synthesis. May possibility na kulang ang tao ng enzymes for DNA replication. Not really kasi may mga certain lang na what do you call that? Itong mga enzyme helicase, primase, DNA polymerase, meron talaga tayo nito kasi pag wala sila, walang DNA replication na mangyayari. There will be no cell division. Hindi din naman mabubuhay ang tao kung walang cell division. Kung baby ta, we continually grow. So kung wala yan sila, hindi tayo mag-grow. Walang functioning of our, what do you call that? Our body. So atong mga organs, wala. So naagid na sila, mga enzymes na. Pero ang problem na is pag may problem ang mga enzyme, like magkaroon na siya og mutation. So mo na siya ang problema kung mali na ang gikopy ni DNA polymerase. Again, pag mali na ang gikopy ni DNA, natay DNA polymerase pero mali na iyang trabaho, yata magka-problema with the mutation and that will lead to a lot of conditions na mga mura na mutated human being. So kana, I hope nasabtan to ang action ni cytarabine with the help of the DNA replication na process. So where do we use our cytarabine? We use this for acute non-lymphocytic or myelogenous leukemia, or we abbreviate that as AML. And the route of administration, this can be given intravenously or intrathecally. So actually, kung nakakita mo og person nga gitagaan og anti-cancer drug, parehas lang naman siya with our other ordinary drugs. Some are given orally, some are given intravenously, though others can be given intrathecally, pero similar lang. Walang masyadong unique except for the part na if you are the one administering the drug, you have to protect yourself so that you will not be exposed to the anti-cancer drug. Okay, next we have here the azacitidine. Again, we call it azacitidine. From the name itself also, you can actually know kung what nitrogenous base siya analog. It's an analog of cytidine, a pyrimidine base. So what happened naman with azacitidine inside the body? So this drug undergoes activation to the nucleotide metabolite azacitidine triphosphate. Sige, parehas sila no, ma-activate sila if there is phosphorylation, meaning we will be adding phosphate in its structure. Mostly ganun sila. Mga anti-cancer drugs natin na-activate pag meron ng phosphate. Now, what happened pag naging azacitidine triphosphate na siya, ang mangyayari sa kanya inside the cell, it will be incorporated into RNA. So this time, the target is the RNA. Okay. Sige, again, this one is incorporated to RNA. Thus, the one that is inhibited is the RNA synthesis. So, cell cycle specific pa rin siya, sa S-phase pa rin. Pero unlike the previous drugs na more on the DNA synthesis, ito RNA synthesis na ang ini-inhibit. So, in your biochem, remember the central dogma of life. You have the DNA. Pwede siya mag-undergo ng DNA replication, pagpadami ng DNA. After DNA, we'll have the RNA. DNA will be converted to RNA. And then, we call that transcription. And then, pwede ka din magpadami ng RNA. So, meron din tayong tinatawag na RNA synthesis or RNA replication. And then, after that, RNA will be used to make the proteins. So, the process of converting RNA to protein is called translation. So, this one is our central dogma of life. Awesome. Most of our anti-cancer drugs na na-mention is, ang kanilang action is here, pero azacitidine is this one. RNA synthesis inhibitor siya. Pag walang RNA, wala ding proteins class. And remember, pag wala tayong proteins, wala ding life. Kasi most of our organs and substances inside the body, most of them are made up of proteins. Ato ang skin, atong buhok, paano kung wala na ta nag-produce of protein? So wala life. And that is also true for the cancer cells. So kung kulang, kung wala protein, hindi mabuo ang cell. The healthy cells and the cancer cells. Where do we use our azacitidine? Okay. Therapeutic use. This is used for myelodysplastic syndromes and AML. Let's see what is myelodysplastic syndromes. I forgot. I read about that last time. I forgot. Okay. When you say myelodysplastic syndromes, ginagatingog mo. Si Jonabel ginaba. Jonabel? No, sana na diha. Okay, again. Myelodysplastic syndrome class is a condition wherein there is an abnormal na okay. The blood-forming cells inside the bone marrow becomes abnormal. So di ba sa bone marrow man ta nagabuhat og red blood cells and even the white blood cells. But the problem if you have the myelodysplastic syndrome, wala pa man jud siya cancer pero nagkaroon kag problem, abnormality sa mga blood cell forming cells in the bone marrow. Call that myelodysplastic syndrome. AML. Ano naman siya? Nagayin ako pa na siya ginamute tapos ma-unmute na po. Jorabel, are you there? Doon sa way siya. Bagi-mute na ko siya no, tapos i-unmute. Tapos ma-unmute na po. Nga naman to. Basig sira ang phone. Okay.
Baka nasira yung phone, ma'am, or nagalag.
Let's see later. Wonder na po mo unmute na po na siya. Tao na to. No, unmute gid ay. Okay, mute na po na to siya. Sige. Okay, let's have that gemcitabine. That's another anti-metabolite agent, which is also an analog of the cytosine. So specifically, this is nucleoside deoxycytidine. Ginagamit siya for pancreatic cancer and non-small cell lung cancer. So makalisang kayo iyahang mechanism of action. Makalisang kayo iyahang mechanism of action, but dili lang tamalisang. Wala pa na ako na gina-memorize sa inyong class. Buang tanig memorize na nato ni. This will just let you see how gemcitabine is being converted in the body. So we have here, syempre, the drug, the DFDC, that's the gemcitabine. Una iyahang murag code or abbreviation, DFDC. Gemcitabine na siya. So inside the body, it will undergo series of metabolism also na ma-convert siya into a lot of substances including DFDCMP. Dili na ninyo kailangan memorizon. Others will become DFDU and pwede siya mahimog DFDUMP from the DCMP. And pwede na po siya mahimog DFDU, pero pagawas naman ko ng DFDU, dili na nato na siya actually magamit. Pero once na the gemcitabine will be converted into DFDCMP, pwede siya ma-convert into DFDCDP. And then lastly, ito yung kailangan natin, DFDCPP na metabolite ni gemcitabine na pag merong ganitong formation of the drug or the substance, it can inhibit the DNA synthesis. And aside from that, aside from inhibiting the DNA synthesis, itong other metabolite ni gemcitabine can also inhibit the ribonucleotide reductase. This is an enzyme na ginagamit din natin for the RNA synthesis. Pwede din siya sa DNA synthesis. It's more on the formation of the ribose. Okay? So again, ayun ninyo na memorize. Gusto na makita ninyo din ha. Gemcitabine undergoes series of metabolism in the body. And then, ang enzyme na ma-inhibit niya talaga when the metabolite is formed is the ribonucleotide reductase. And meron siyang metabolite also that can inhibit the DNA synthesis. Kasi ma-incorporate itong DFDCPP, ma-incorporate siya sa DNA strand. And then, magkakaroon siya magkukos siya ng pag-terminate ng DNA replication. Okay, that's gemcitabine. And then, number 9, daghan kay tag-anti-metabolite, no? We have the 6-thiopurines. To be specific, we have here the 6-mercaptopurine or the 6-MP. Again, 6-mercaptopurine ang pangalan ng drug, or we abbreviate that as 6-MP, which is the first thiopurine analog for cancer chemotherapy. That's a board exam question. Purine ha, purine. Sa ganitong purine, guanine and adenine. Do not forget that. Purines are the guanine and the adenine. Dalawa sila. So pwede either of the two. And then thiopurine siya, meaning thiol means sulfur. So there is the incorporation of sulfur here. So first itong 6-mercaptopurine na pwedeng gamitin for cancer. But where do we use the 6-mercaptopurine? Ginagamit siya for the treatment of childhood acute leukemia. So para sa mga bata na magkakaroon ng leukemia class, ang ginagamit natin as chemotherapy is the 6-mercaptopurine. Okay? Nonsa na ni si Jonabel din he. Okay, and then we have the 6-thioguanine. This is specific for the guanine class, pero 6-thio pa rin. Ang kanyang mechanism of action is the inhibition of a lot of enzymes involved in the purine nucleotide biosynthetic pathway. Pero ganun pa rin, DNA synthesis pa rin yan pag sinasabing purine nucleotide biosynthetic pathway. Gagawa tayo ng mga purines, especially the guanine, para magamit sa DNA synthesis. Now, if that is inhibited, wala ka nang mafo-form na guanine to be specific, and then wala na tayong ma-incorporate doon sa DNA and sa RNA synthesis. Okay? Questions so far? Wait lang ha. Okay. Any question? Wala. Sige. Okay, clinical application. Clinical application for our 6-thioguanine. It has a synergistic action with that of cytarabine. Pag sinabay sila kasi synergism, no, pwede siya gamitin for adult acute leukemia. The thiopurines are for the childhood leukemia. Ito namang thioguanine is in combination with cytarabine for adult acute leukemia. Now, take note of this, thioguanine is contraindicated. Dili siya pwede isabay with allopurinol, which is a xanthine oxidase inhibitor ginagamit natin for gout, because actually xanthine is coming from guanine, right? So magkakaroon sila ng interaction, magkakaroon sila ng antagonistic na interaction. So hindi sila pwedeng isabay. We are done with our anti-gout, no? Tapos na ba ito sa itong anti-gout? I think humanataan na sa ito ang anti-inflam nga slides. And then I think na-appeal na kog mention dito si xanthine inhibitor, si allopurinol, na ana siya pathway na before siya nahimog xanthine, gikan siya sa guanine. So since this one inhibits guanine formation and then the other one needs guanine for it to be produced, then mag-antagonistic ang ilang action. That is why contraindicated sila with each other. So that ends the anti-metabolites. We have 10 of them, but for anti-folate alone, we have 3. Tatlo para dito sa anti-folate agents. There silang tanan anti-metabolites. They are analog of the compounds normally found inside our body that are used for DNA and RNA synthesis. So do not forget, ang mga anti-metabolites natin are cell cycle specific. Most of them are specific on the S phase of the cell cycle, katong synthesis phase. Naay pangutana, clarifications? Wala, before ta mag-move on sa another group of drugs. Iba na naman ito. Hindi na ito under sa anti-metabolites. Ibang group na ito. Wala. Ay pangutana. So let us continue. We have here the antibiotics. I have told you yesterday that just like our treatment for bacterial, viral, fungal, and other microorganism na infection, meron din tayong antibiotics for cancer. Again, meron din tayong antibiotics for cancer. So some of them are derived from other types of cells or other microorganisms, and they are able to kill cancer cells. So antibiotics pa rin ang tawag sa kanila. Now, paano nag-a-act itong mga antibiotics for cancer? So mostly, it's more on the DNA pa rin. Magkakaroon pa rin ng problem with the DNA function, especially on the topoisomerases, both 1 and 2, and the production of free radicals. But take note that antibiotics are all cell cycle non-specific except Bleomycin. So dili jud sila cell cycle specific kasi iba-iba yung kanilang action. Hindi sila nakafocus kung synthesis lang. No, they are non-specific sa cell cycle. Pero let me discuss the action of the topoisomerases. I hope you are familiar with the topoisomerase, but kung dili familiar, sige. Balik ta sa ato ang DNA synthesis class. So, di ba DNA is a double helix and it needs to be separated for the replication to happen. And the one that is responsible in separating the two strands is called the enzyme helicase. Okay? And then so on na ito ha. After helicase, you have the primase and then the DNA polymerase. And then we have the exonuclease. And then lastly, the DNA ligase. The DNA ligase means kanang i-paste or i-join together para, di ba, duha na to ka strand para magdikit na sila and mag-double helix sila ulit. That's the work of the DNA ligase. But wherein the equation is the topoisomerase. Actually, topoisomerase is here. Kasi trabaho ni topoisomerase. That is why hindi ko siya sinali kanina because the topoisomerase enzyme is a kontrabida. Kana sila tanan na sa taas, needed for DNA replication. Wait lang. Ayan. And then si topoisomerase is a kontrabida to the DNA replication. Kasi trabahoan na niya. Diba iyan, the double helix i-separate sila into two. Dili din na siya kontrabida. Sorry. Dili na siya kontrabida di lahi ang kontrabida ang mga antibiotic drugs. So, na-separate na sila into 2 by helicase. Ang problema manggod sa gibulag nimo magbalik dyan na. Ang mga DNA strands na to, once na they are separated, they have this high tendency na mag-intertwine ulit. So magbalik sila. Kontrabida din si topoisomerase sa pagbalik mo na kung ginamin kagayina. Now we need the topoisomerase to keep these two strands separated. So kontrabida sila sa pagbalik og intertwine. Mo na trabaho ni topoisomerase. Kay pag wala na si topoisomerase class, mubalik na siya og double helix. And pag mubalik nag double helix ang DNA, all the other processes will not happen. So there will be no replication. Now for antibiotics, for our antibiotics na chemotherapy drugs, they will inhibit the topoisomerase. Now once we don't have the topoisomerase, then there will be walang mag-hold together sa mga strands para hindi sila mag-double helix ulit. Okay? So, ang tendency mag-double helix siya, walang DNA replication. Yan mostly ang trabaho ni antibiotics. Si topoisomerase yung friend na gasabi na kailangan. Yan yung friend mo na nagsasabi na dili nimo dapat balikan imuhang ex. Mao na siya ang trabaho class ni topoisomerase. So kung i-inhibit nato si topoisomerase, magbalik gyud na ang duha ka strand and there will be no DNA replication. So except bleomycin ha, ang silang tanan cell cycle non-specific. Now, what are these antibiotics? What are these antibiotics? The first group of antibiotics are called anthracyclines. And what are these specific drugs under the anthracyclines? We have the doxorubicin, daunorubicin, idarubicin, epirubicin. They end with rubicin, but we have an exception there, the metosantrone. Exception na siya. They are called anthracyclines because their structure is derived from anthracycline. Okay? Pare-pareha sila og structure. Okay. So mechanism of action for our anthracyclines, they are converted inside the body as free radicals. And these free radicals na converted from the anthracyclines can induce membrane lipid peroxidation, DNA transition, and direct oxidation of purine and pyrimidine bases, thiols, and amines. So number one, it can affect the lipid metabolism, especially that of the cells, especially the cancer cells. It can do DNA transition. So magka-problem tayo with the DNA strand, mapuputol yan. And thus, walang yung i-replicate mo, hindi na siya tama kasi na-stop nga, maputol na. And then there will be problem also with the production and formation of the nitrogenous bases needed for the DNA and the RNA synthesis. So we have there the purine and the pyrimidine bases. Ma-oxidize sila. And other pa na mga compounds needed for our DNA and RNA synthesis, mga thiols and mga amines. So this is the reason why class anthracyclines are cell cycle non-specific. Wala talaga silang specific na phase sa cell cycle na doon lang sila mag-a-act. Maraming action si antibiotics. It can affect though the DNA synthesis, but aside from that, may mga other additional mechanism of action pa siya. Okay? Now, let's talk about the adverse effects of these antibiotics. We have here irreversible dose-dependent cardiotoxicity. This is class a board exam question. Ato ang, especially the daunorubicin and the doxorubicin, they are notorious of causing cardiotoxicity. They can be harmful to the heart. And ang ilahang pagguba sa heart is most of the time irreversible, but dose-dependent. Meaning, if you reach a certain high dose, that's the time makaguba siya ng heart. Pero if we control the dose sa low level lang, then wala siya problema. Wait lang, hamoy naman yung tubig. Okay? Sige, let us continue. Again, the cardiotoxicity is common to daunorubicin and doxorubicin. Though, if we are going to change the dosage form of the doxorubicin, we will encapsulate it. We will have the liposomal encapsulated the doxorubicin. It will become less cardiotoxic. Now, what is the antidote para hindi naman siya magiging very harmful to the heart? We have here the dexrazosane, which is an iron chelator. Ano siya, mag-chelate siya with our anthracycline antibiotics para again, di siya mag-cause of problem with the heart. So si doxorubicin is actually coming from the daunorubicin. It's a hydroxylated analog of that drug. And ito yung most of the time ginagamit talaga for cancer chemotherapy. So this is very widely used. However, since we have treatment protocol for cancer, just like other anti-cancer drugs, most of the time, we use doxorubicin in combination with other agents to treat various types of cancer. So, halos tanan no, klaseng cancer, sarcoma, carcinoma, lymphoma, and even leukemia. Now, daunorubicin and idarubicin are both treatment of leukemias. Itong doxorubicin, kaya siya ginagamit kasi effective siya for different types of cancer. Itong dalawa na, although kapareha naman niya, na rubicin pa rin, anthracycline pa rin, pero most of the time, we use these two drugs for acute leukemias. And take note, the mitosantrone is used for prostate cancer. It's an antibiotic. It's still under the anthracyclines, but iba yung gamit niya. Most of the time, ginagamit siya for prostate cancer. Now, number 2 for our antibiotics is the bleomycin, which is a drug that has copper in its structure. Okay? It's a mixture of different copper chelating and not copper in its structure but copper chelating glycoprotein. It's a protein that can chelate copper. Yan yung trabaho ni bleomycin. Now, unlike the anthracycline antibiotics, they are this one is a cell cycle specific and ang kanyang target is the G2 phase. So, mag-cause siya na cells to accumulate in the G2 phase. Yun yung second growth phase wherein supposedly the cells are trying to prepare for mitosis. But yun ang target ni bleomycin. So hanggang dun yung mga cancer cells, for example, mag-G2 phase silang lahat. So mag-accumulate silang lahat doon sa G2 phase. Now, where do we use bleomycin? We use this for testicular cancers and Hodgkin lymphoma. So ano yung mechanism of action ng ating bleomycin? We have here DNA bleomycin iron complex appears to undergo oxidation to bleomycin and then ferric. Ferrous yung kanina, magiging ferric siya. Now, the liberated electrons react with oxygen to form superoxide or hydroxyl radicals, which in turn attack the phosphodiester bonds of DNA, resulting in strand breakage and chromosomal aberrations. So pag mag-administer tayo ng bleomycin sa patient, inside the body, it will be incorporated to DNA. So may bleomycin ka dyan. But aside from that, the iron in our blood will also be incorporated, but that is in the form of ferrous Fe positive 2. Now, further metabolism of this will actually lead to the oxidation. Magiging bleomycin, instead of ferrous, magiging ferric siya. Meron kang ni-release dyan na electron, kaya siya na-oxidize. And then, itong electron na ito will become a free radical. So remember, di ba, free radicals in the body are harmful, especially to our cells. So itong free radical na na-form, ito yung magiging cytotoxic. Ito yung magta-target sa mga cancer cells. So especially on the DNA, kasi di ba si DNA is alternating sugar, phosphate, and the bond between this sugar and phosphate is what we call phosphodiester bond. Kung na-target yan siya ni free radical, mabibreak itong chain na ito, and that will result to problems with the DNA. So, wala na ding DNA replication and so on. That's the action of bleomycin. Now, what are the adverse effects? We have here some general adverse effects like alopecia, mucocutaneous reactions, changes in the skins. Mana makita ninyo usahay mag-hyperpigmentation ang mga undergo chemotherapy, mangitom sila. The drug will activate the release of the pigments. And then high incidence of fever and chills, and naka-bold kasi board exam question ito. Ang target kung si daunorubicin and doxorubicin targets the heart, the bleomycin naman targets the lung. So natin ginatawag og bleomycin lung. Makaguba siya og lungs glass, so mura kag TB na ay mga scarring of the tissues sa lungs. Okay, kulang kog time, it's already 10:30.